Good morning, everyone. I'm Dr. Bruce Lian. I'm the interim CEO of Uconn Health. I'd like to share a special warm welcome to our Governor, Ned Lamont, the Commissioner of the Department of Social Services, Gifford. Oh, okay. And also Commissioner Manisha Juthani, who is right here, and all distinguished guests. My sincere thanks to our interim Uconn President, Redenka Merrick, who's here joining us, and all our healthcare providers with experts on maternal fetal medicine and OBGYN. Where you are is what we call outpatient pavilion, which is home to our Women's Center, a fitting location for today's event, as so many moms receive the vital prenatal as well as postpartum care they need and deserve right here. In May, the state actually named Uconn Health a center of excellence for maternity care, given its high quality and cost effectiveness. We know access to maternal health care before, during, and after pregnancy is vitally important for both moms and babies, and for their most positive and healthiest outcomes. There should be equal access to quality maternity care. We at Uconn Health are also strong advocates for reducing and eliminating health disparities. This is why Uconn Health is extremely pleased to see the state's recent and planned expansion for maternal health care coverage to help women and their babies stay healthy, no matter their financial status or immigration status. Thank you to the governor and his commissioners for working so hard to help pregnant women receive the prenatal care and additional postpartum support that they need. I know you have a lot more details to share, so I'm going to cut my remarks short, and it's my distinct pleasure to welcome again to Uconn Health Commissioner Gifford. Thank you very much.
Good morning, everyone. Thank you, Dr. Liang, President Merrick, and all our guests from Uconn Health, Governor Lamont. Very nice to be here. I, as a formerly practicing obstetrician gynecologist, I am particularly proud and pleased to be here this morning to talk about what the Lamont administration is doing and the steps we are taking here to improve maternal health outcomes and reduce disparities in health outcomes in the state of Connecticut. These are some very significant and important steps, and I'm very happy to be able to talk a little bit more about them in detail. Why is this important? We have about 35,000 births per year here in the state of Connecticut. About 14,000 of those, or 40%, are covered by Husky Health, our state Medicaid program. So we are a very significant payer for childbirth and postpartum care in this state. I'm sad to tell you that the United States has actually gone backwards with respect to maternal health, and in particular maternal mortality, over the last couple of decades. The 20th century saw absolutely remarkable progress in maternal health, to the point where in the 90s and early 2000s, maternal deaths were extremely rare in the United States. We have unfortunately seen that trend reverse, and we have seen increases every year in the United States since 2018. Furthermore, deaths for non-Hispanic Black women are 3 times as high in the United States as they are for white women. Let me say that again. Deaths, maternal deaths, those related to pregnancy and the immediate postpartum period, are 3 times as high for Black women in the United States as they are for white women. This is a situation that urgently needs to be addressed, and many of the steps that Governor Lamont and the administration are taking are meant to address this unacceptable disparity. In Connecticut, we have about 5 to 6 pregnancy-related deaths per year. So it's a very small number, and that number has been consistent between 2015 and 2019. But again, in Connecticut, non-Hispanic Black women are overrepresented among those who result of a pregnancy or pregnancy-related condition. Importantly, in Connecticut, about half of those pregnancy-related deaths occurred between 6 weeks and 1 year postpartum. So it's very important that women have access to care, not just during prenatal care in the immediate postpartum period, but for that entire year postpartum. And experts both locally and nationally have been advocating for a long time that Medicaid should expand coverage for pregnancy to a full year postpartum. In addition, a couple of other things to know about our statistics in Husky. About 34% of our births are by cesarean delivery, more than 1 in 3. That's one of the highest rates in New England, and a place where we want to focus. 8% of our babies born in Husky end up being admitted to the neonatal intensive care unit. 28% of women have some sort of adverse pregnancy-related outcome, and 5% of our babies have what's called neonatal abstinence syndrome, or the effects of maternal substance use disorder during pregnancy that ends up impacting the infant. So given all of these things, what is the Lamont administration doing? First of all, we are going to continue to ensure prenatal coverage for every child born in Connecticut. As an obstetrician-gynecologist, I know firsthand the critical importance of early and regular prenatal care to a healthy pregnancy outcome. So as of April 1st of this year, we have expanded prenatal coverage under Husky to all women who qualify, regardless of their immigration status. That will ensure that every baby born in Connecticut has a healthy start and a healthy mother. We expect about 1,400 women per year to qualify for this new benefit, and nearly 600 have already enrolled. Second, we are extending and have extended postpartum coverage for 1 full year as of April 1st of this year. That means that women who otherwise would have lost their Husky coverage after 6 weeks will now remain enrolled and have the benefits of full health care coverage for an entire year. We expect about an additional 1,000 women to benefit from this new expansion. Third, we are beginning the process of paying for care differently in Husky. We all know that how we pay in healthcare can have an impact on how services are delivered. So we are establishing what's called a Maternity Bundle. We've been working closely with the Office of the State Comptroller, who has already implemented such a Maternity Bundle in their health insurance program. What will this bundle do? First of all, and very importantly, we will provide feedback to providers on how they're doing on a key set of quality measures, including focusing on disparities in birth outcomes. How are they doing on their C-section rate? How are they doing on their NICU admissions? How are they doing on adverse maternal outcomes? That will allow providers to know where to focus and how to potentially change the way services are being delivered. Very importantly, and a very exciting development, we are integrating doulas and breastfeeding support into that payment bundle. We know that healthcare outcomes can be improved with the support of a doula, and you're going to hear from an expert on the subject very soon. So our new payment bundle will help pay for both of those things. Our goals with this new payment bundle are to address disparities in birth outcomes, particularly focusing on women of color and those with substance use disorders for additional supports. To reduce our cesarean delivery rate, which, as I mentioned, is the highest in New England and 6th highest in the United States in Husky. Reduce adverse maternal outcomes, and reduce our neonatal abstinence syndrome rate. Next, to further support women after birth, we are going to begin this fall working across multiple departments, but led by our Office of Early Childhood. We are piloting a universal home visiting and community health worker program beginning in the city of Bridgeport. This program, which we are using ARPA funds to begin, will give every family the opportunity to have a home visit from a trained registered nurse between 1 and 3 home visits. This nurse will be specially trained in issues around both for babies and mothers that occur in the postpartum period. So there'll be additional screening for intimate partner violence, there'll be screening for substance use disorder, there'll be screening for depression, very importantly, and also looking at the health and development of the newborn and providing education and support to the family. Furthermore, for those women who are identified as needing additional supports, we are pairing the Universal Home Visiting Program with the Community Health Worker Program. Some women will be referred and partnered with a community health worker, a woman from that community who's familiar with issues around childbirth and early childhood, and provide additional support and referrals for those families. And finally, we are, of course, beginning our Covered Connecticut program. Starting July 1st, we're expanding our Covered Connecticut program. This is a program that will provide no out-of-pocket cost health insurance through our health insurance exchange, Access Health Connecticut, so that women who aren't pregnant but may be between pregnancies or may be thinking about getting pregnant but don't have health insurance will also be able to access high-quality, no-cost health insurance through Covered Connecticut. So all in all, it's a large package of initiatives that we are really thrilled and delighted to be offering to improve the health and outcomes for pregnant women in Connecticut, following on the governor's directive to make Connecticut the most family-friendly state in the country. This will certainly support those families who are having children. So with that, I am delighted to introduce to you all Ms. Cynthia Hayes. She is a practicing doula and breastfeeding consultant, and she's going to talk a little bit about what it means that Connecticut Husky is expanding to include care from doulas.
Thank you to the governor and commissioners and all other distinguished guests and advocates. It is such a pleasure to be here, and oh, how I have lived and waited for this day. We are so encouraged that the state of Connecticut is really on the cutting edge in implementing doula services and making access available to every woman that wants a doula. So let me first explain, and I won't be before you long, how that may be beneficial. Doulas, as some already know, are birthing professionals. We're not medical professionals, but we are there simply to support the birthing parent before birth, during birth, and also postpartum. That's basically it. In terms of what we do to advocate, we just advocate for whatever the birthing parent and her family has decided will be the best way for her, or however they describe themselves as birthing parents, to give birth. And by having a doula present before your pregnancy and during your pregnancy and postpartum, we believe and we know through research and other information that's out there and through our experience that we can help to lower that C-section rate. We can initiate breastfeeding, especially among those that are experiencing the disparities, as the commissioner already mentioned. We are there to help give the birthing parent and their family any type of support that they need to get the birth that they want. And I've been involved in many conversations with Department of Public Health and now Department of Social Services, and I have been so encouraged by all of those in the state of Connecticut that has come forward to provide support, and they're really getting it right. They know what's going on, they are aware of the statistics, and they're aware of how doulas can work alongside medical providers to reduce these disparities. And I don't know if people are aware, but there are not too many states in the United States that have actually implemented legislation for this effort. We're surrounded by Rhode Island. They have pretty good legislation, and so we're very encouraged that we're going to increase this access to Connecticut families, and it's been such a pleasure to work with everyone that is with us and wants to see to that end the families have the births that they want, and to reduce these disparities, reduce some of the what we refer to as near misses and some permanent damage. Even if they're alive, they're not getting the experience that they want. And we are so glad and we're so proud of our legislators that have passed legislation so that we can move forward. And it's been a slow process, but it's been a steady process. And if anybody wants to get in touch with us to find out more about the information, they certainly can. Thank you.
Thank you, Cynthia. Thank you for your partnership and all of your great work on behalf of the women and mothers of Connecticut and their newborns. Now I'd like to introduce Dr. Jody Terranova with Uconn Health, who's going to speak a little bit about what this means from the pediatrician's standpoint and how this might improve health for children and families. Dr. Terranova.
Thank you, Commissioner Gifford, and thank you, Governor Lamont. As a pediatrician and as the president-elect for the Connecticut chapter for the American Academy of Pediatrics, I speak on behalf of many providers. I get to meet regularly, about once a week, with my colleagues across the country, and I recognize how fortunate we are in Connecticut, and we really are one of the most family-friendly states, so we're well on the way to claiming that moniker. As an individual, as an institution, and as a state, we recognize the importance of providing the best care possible for our patients and families. And this package of bills will really help us to do that more. We heard from Cynthia how important it is to really have a team that's taking care of moms and babies. You know, as pediatricians, we're kind of after the baby is born, here we are to help the mother raise their baby. But we can't do that without really that important prenatal care, and the additional extension of postnatal care for up to a year is really going to help moms reduce a piece of stress in their life, to be able to know that they can seek care when they need it and not have to worry, whether it's something that was diagnosed during pregnancy like hypertension or diabetes, or just being able to access their routine care and be able to get their checkups and their screenings that they need. We know that healthy moms lead to healthier babies, and so being able to have that access is important. And the really other nice piece that I'm so happy to hear about is the extra breastfeeding support, because during this current crisis of infant formula shortage, we've realized that there are many barriers to moms being able to breastfeed successfully. And so having that additional support after the babies are born, for mom to be able to have either someone that comes into their home as part of the home visiting program, or to be able to access lactation providers and breastfeeding support, is going to help moms be more successful in breastfeeding and be able to help babies grow up healthier. So we're very appreciative of all of this support and thank the state for being a leader. I'm very proud to be in Connecticut. Thank you.
Thank you, Dr. Terranova. And now I'd like to introduce a person that I'm very happy to call my partner in all of this work. One of the things the governor has said to his commissioners since the day we started, and you've heard me say this before, is he wants to see us all working together. He doesn't want to see silos created within the agencies, and wants to see these important initiatives be coordinated across our departments. The work that we're talking about this morning is extremely important that we are coordinating with the Department of Public Health. So I'm very pleased to introduce our commissioner, Dr. Manisha Jutani.
Thank you very much, Commissioner Gifford, and it has been an honor to be a part of the Lamont administration, recruited in to work together with Commissioner Gifford. And as she said, we started out as partners. Of course, I took the role that she was in, and so right from the beginning we've been working together. It started out on COVID, but we are able to expand that collaboration onto many topics, including what we're here to talk about today. So we've just been given a lay of the land in terms of where we stand with maternal health in our country and in our state. And what a remarkable statistic that Black women are 3 times more likely to pass in pregnancy or have a pregnancy-related complication. One of the ways that we as a Department of Public Health are addressing part of this is through a legislatively determined committee that has been set up called the Maternal Mortality Review Committee. And this MMRC meets on a regular basis and reviews deaths that have occurred in the state of Connecticut. For example, the last report that I received in April reviewed 2 deaths of women that occurred in 2021. And when you read the narratives about what happened in the lives of these women, you can often hear some of the things you're hearing that our legislators and our administration has been addressing through reforms that are in place. So for example, a woman who, after those first 6 weeks, when maybe there is the most attention to a woman who's given birth, falls to depression or substance use disorder. Think about anybody who's had a child here. Do you have it all figured out after those first 6 weeks? Not really. That may be where the most attention is paid, but we all know the challenges that any new mom has and any new family has. And so when I read these stories of women that may have become depressed or are struggling with trying to figure out how to care for a newborn, or maybe relapse on substance use disorder that they were able to keep in check through their pregnancy, but now are just overwhelmed and trying to figure out how to make it through. The MMRC, Maternal Mortality Review Committee, reviews these cases and comes back to us, and this is where you see the birth of legislation, where we are looking at covering these mothers beyond those 6 weeks, where we have a huge 3 different bills passed around mental health that were passed in this past session, is going to address not just the large issues that are affecting our children, but women who are pregnant as well. And the opioid use disorder pandemic that we've got going on as well, that we are looking to address as we emerge from the COVID pandemic. These are all the resources that are going to be so important to help address this very issue of young families and women who are going through the childbirth process. So in addition to that, we've now heard about doulas and the great contributions they make to women who are going through this process. And as part of the Department of Public Health, one of the things that we are doing moving forward is convening a scope of practice committee. And the goal of this committee is really to look at all the services that doulas provide, look at people that are doing the work right now. We don't want to exclude anybody who is doing this very, very important work. And we want to bring people in who have been doing the work so that we can create, hopefully, a certification program. That would be our goal. Our goal of this committee that is being put together is to come up with a way forward that includes as many people as possible who have been doing this work and create a pathway so that they can be reimbursed for the work that they do. And this is something that is available to all communities, to all people who are giving birth, so that it is not something that only people who have the ability to pay out of pocket, for example, are able to do, and that we are able to enable the greatest number of people in our state to have a pathway to be able to receive this service that we know is helpful to people, to have that person at the bedside. In the old days, you may have had a grandmother, a great-grandmother, a mother, a sister, and a whole family around you. And our society has moved in a way where you may not have those kinds of resources, but having a doula is something that can certainly help so many people. So I really look forward to the process that we are starting in the Department of Public Health, and with the work that the Department of Social Services is able to do through our Husky program, through the various programs that exist, to enable that work to be reimbursable so that we can really provide optimal care to young mothers. That's going to be the way that we make Connecticut the most family-friendly state in the country. So I'm thrilled to be part of the Lamont administration and be able to continue this work. And with that, I would now like to introduce Governor Ned Lamont.
Well,
Hey, thanks, Manisha and everybody. Here's what I just heard from a layman's point of view. First of all, each and every one of you at Uconn Health and what you're doing right here, as Bruce said, this is a center of excellence. That means you're the best of the best. That means you give those babies and those moms the very best opportunity at the start of life. And that's a healthy start. And that's worth remembering. And for that, I want to thank each and every one of you. You heard a few times family friendly. And let me tell you what I think that means and what that means in terms of the legislation that we passed right here. That when you are ready to have that baby, we want to give you every advantage and want to give that baby the very best advantages in life. And that's why we're going to start by providing care with the doula. Cynthia, wherever you went, thank you for what you do there. You know, before birth and after birth. And after birth means, you know, not just for 6 weeks, for a long period of time. You heard about a lot of the complications that maybe happen, you know, many weeks after birth. We cannot leave those moms and those babies behind. And that's a big piece of what this legislation means. And it doesn't stop there when I talk about family friendly and we do this together. And we're going out to the community. It's not just you go to a website and you know, log on for information. We're trying to get doulas out to the community. You know, Deirdre mentioned what some of the tests we're doing to get people out there, knock on your door, give you the very best confidence, the very best hope. And when that child is born, we'll have the greatest expansion of infant and toddler daycare in the history of this state. And I want to make sure that you know that we're there with you. And you know, you got a mom, you got an aunt, you got some other people with you, but we're going to be there to provide the technical support you need and some of the support you need in terms of daycare as well. We've also instituted what we call paid family and medical leave. Family leave, that means you get a little time off, mom as well as dad, you know, before and after birth, just to make sure that you have the very best opportunity, that child has the very best opportunity at the start of life. And I care deeply about the incredible racial disparities you heard described here. We're making a particular emphasis in those communities hardest hit. If we found one thing after 2.5 years of COVID hell is that basic health care is an individual right, and we're going to fight for each and every one of you. But also, if you don't get the very best care, that impacts everybody else in the community as well. So we want to make sure this is as broadly available as possible to everybody. And by the way, nobody's asking you about your immigration documentation. We want you to be taken care of as best we can. And one last message for those folks, early childhood, daycare, and now we have the child tax rebate or child tax credit. We've had tens of thousands of people have signed up for that right now. Those are any you know, moms or families that have a child under the age of 18, but we have hundreds of thousands more to go. I want to make sure you have the financial resources to be able to take care of that kid, take care of that you know, teenager, give them the very best opportunity. And you've got another 7 weeks to sign up, so I hope you take advantage of that. But I'm particularly proud of Connecticut today. I'm proud of each and every one of you. And Bruce, I love what you said. I mean, we've got the infant formula shortage, but here at Uconn Health, they had a stockpile, so they were able to make sure that any you know, mom in need, we're able to take care of that. And all the donations you said of breast milk as well. Connecticut folks continuing to do the right thing. We have an increasing supply, a very slow increasing supply. I think we'll be back to where we ought to be in about 6 weeks. But in the meantime, thanks to the good folks here at Uconn Health, we're managing through. So I'll end with the way I started. To each and every one of you who are ready to have that baby, we're here to support you as best we can. You got a mom, you got an aunt, we've got a doula. We're there before birth and after birth, making sure that you and your child have the very best start. Thanks, everybody.
If it's one of the commissioners, I'm not sure who would be best, but just for the doula certification process, what's the timeline looking for that? Because I know you want to get this 1-year care going, but if they're not certified, who's going to do it?
So the first step is this committee that's being set up. And our goal would be that we have something ready and recommendations so that when the legislature comes back together, they give us authority to be able to certify doulas. So that will require another legislative step. That has not been done yet. But I feel confident that we can work with our legislature and with information that we're able to put together with this committee that we have been given the authority to do so in this session, that we will be able to do that going forward.
Would a woman's pediatrician be the one to recommend a doula? I mean, many people don't know who doulas are and what they do. So how do pregnant women take advantage of it?
Well, I'll give it to Commissioner Gifford, but I would say most likely, at least one way would be the obstetrician gynecologist to start for the patient, but go ahead.
So I mentioned our maternity bundle, which is that new way of paying for services that we're working on for Husky. And what we will be doing in that is requiring that our providers in the Husky program, which is 40% of births, start to establish relationships with doulas and breastfeeding consultants so that they can have this network for referral. So Commissioner is right, most likely it would come through an obstetrician. Cynthia would tell you that many women come to doulas on their own. They've read about them, they've heard about them from a friend or a colleague. They find a doula on their own, but we're going to up that a little bit and make sure it's integrated, at least in Husky, into our prenatal care.
And I remember when I was pregnant, that a challenge for a lot of women was that they had lactation specialists in hospitals, but they were part-time. Some hospitals didn't have them. So is this another step up by doulas to be able to work with pregnant women to establish breastfeeding?
Yes, and in addition to doulas, as part of our Husky bundle, we'll be including breastfeeding consultants as well, because we know of the importance of that support, particularly postpartum. And don't forget our Universal Home Visiting Program, which is starting in Bridgeport, but which we hope to expand to the entire state eventually. Those are trained, registered nurses. They will be there to help support women in those very first few weeks when often breastfeeding can be the most challenging, and then refer to a community health worker who will also be trained in postpartum issues, who can also offer some breastfeeding support. So we're wrapping around lots of different services.
And you keep hearing about healthcare worker shortages. So how many doulas do you think we have in Connecticut right now, and will we need more? There's the shortage is popular.
I don't know if Cynthia knows an actual number. Do you know?
I don't know that we have an accurate number, but as I was mentioning when having conversation with the commissioner, there still needs to be a lot of information and education to come to the community so that they can make a decision as to whether or not they want to do a. I suspect that right now we do have enough that would meet the demand. So I don't think that there'll be an onslaught at first, because this is a very new thing, a very old concept, but a very new idea to a lot of the community. So yes, and we continually are training doulas often through the various programs throughout the state.
Dozens, hundreds of doulas in Connecticut.
Right now, I can't give an accurate number. I mean, I'm a part of a collective, and we've trained over the past few years about 75. So and we're still training continually through our program. So it's hard to say, but I'm sure whatever we need to do, we're going to do it. Thank you.
With this new pilot program, what's the payment structure for doulas? Are they going to be reimbursed through Medicaid for this specific pilot program?
The payment is through a bundle, what we call a bundle. So there'll be one payment to one provider, and then that provider would be responsible for bringing on the doulas and the breastfeeding consultants. So there won't be a direct payment or a provider relationship between DSS and the doulas. It will come through the primary provider who's providing the prenatal and interpartum and postpartum care.
For the pilot program, is there a date? I know that you said that you were kicking off the pilot program with ARPA funds. So is there, before you hope to continue it indefinitely after the pilot program, what's the timeline?
The Universal Home Visiting is with ARPA funding, not the Maternity Bundle. Okay. The Maternity Bundle is a Husky program. So that's standard state share, federal share. the way we currently fund our childbirth now. We're just changing the way we pay. The ARPA-funded universal home visiting, we are already talking to some additional communities and have a little bit of funding to start. And then we're going to be looking for either Husky funding, commercial insurance funding, or other sources of funding as we expand the universal home visiting across the state.
So the state money will take care of the expanded, the doula, and all those other, the ARPA money is being used specifically for the home visit.
Correct. And I should add, there's some CDC money in that pot too. So there's a health equity grant that was received by the Department of Public Health that's going to help us fund the home visiting and community health workers in the early period as well.
Has this maternal bundle, I think I'm saying the right word, is this been used in another state, and have you seen it work? Because I know that there's a mention of a few other states.
Yes, but it's not only being used in other states, it's actually being used right here in Connecticut through the Office of State Comptroller. So the State Employees Health Program has already started a maternity bundle, which is great for us because our providers are already used to the measures and the types of work that's involved. Maternity bundles have been tried in Husky in a few other states, and I think they have resulted in improvements in care, and we're just going to keep building on those experiences.
So adding to what exists.
Correct.
Thank you.
Is there an update to the states? I know the state legislature passed a law that would allow women and families to get reimbursements for donated milk to buy it through Medicaid, and that program has not yet gone into effect, especially when we talk about the milk shortage. People in the Medicaid program can't use those benefits as of now to buy at the dispensaries. Is there an update on when that might happen?
I don't have an update for you, but we can, if you follow up with us, we'll certainly get that for you.
Thanks, everybody.